So this is like segmenting the airway. So we are changing our histogram to make sure that we're highlighting the areas that are black and this full air. So I went to the more negative numbers so we can see everything is highlighted that it's air. So I'm trying to make sure that we can determine like if this airway has any compression, which is critical for patients with complex heart disease, including heart ataxia. So we can see how the upper lobe there is compressed. Um, I'll finish segmenting this and show how it looks in with the rest of the heart. But based on that anatomy, we know that this patient has a right um, isomerism based on the anatomy of the airway. So sorry, left isomerism. So then I'm gonna bring up the heart here. And this is what I like to see, is the anatomy of the airway along with the rest of the heart. So I'm gonna segment some more this heart, especially the aorta. So for that, I'm gonna have to change more to the contrast area. So it were right there. So I'm going to segment the aorta a little further. I have to select the structure that I'm working on. And that makes you work on that one segmentation. This is just critical as we're having this very complex anatomy on this patient. Let's segment more towards the lung. This is very important to just understand a lot of the anatomy, pulmonary veins, pulmonary arteries, and that very tortuous ductus there. All right, so I'm gonna show now airway and the complex heart. I'm gonna crop through and just see in the anatomy. You can see the large VSD. It's a left arch and it's a left SVC connecting to the morphologic right atrium in the left. Large ductus, which this is a study pre PDA stent. And then we have that airway that we can see because of the aorta has this very elongated horizontal anatomy. If we go straight AP, we can see how that shifts all the way posterior and from right to left. So that's part of why that airway seems compressed. So it's the aorta compressing. And then that ductal tissue also is compressing some of that airway, which is interesting to see. We didn't think that was going to cause an issue after PDA stenting, and clinically showed that it was fine as it's straightened this way. So an easier way to do this is if we actually have a volumetric, so we can hide all this and go to a volume rendering. And this is a very nice tool when it says full, because we can have a lot of the airway and lungs as well. So I'm gonna crop through just to show that. You can see the lungs, and then we'll be able to see the airway in this same segmentation. We can change the contrast and see more. Or instead of using this, we can do the clip sphere, which I liked, as you can make it as big as you need and just go to the area of interest. And then we can go to coronary CTA or cardiac CTA, either way, and then changing the contrast, you can see more of the intracardiac anatomy and erase some of that noise. Noise or natural structures, but this is just me trying to do this fast. So we can see nice PDA there. We have hidden most of the right, or the SVC and the morphology right ventricle. We can see the anatomy of the branch PAs there very nicely. And we can keep working on that too, if we can just highlight that area for the PDA. It's easier to do. We just change some of these features. We can bring that, we just see that as a change. I also brought the ribs more in contrast, and we can just remove those later with cleaning. There's a way to place a mask and hide all those things. But that's a nice thing, showing the stump of the pulmonary artery with a big gap to the RV. The branch PAs look fine, but the duct is inserting into the LPA, which tends to be a challenge, but technically was fine for the ductal stent. And that's the easy way. As you saw, it was a couple of clicks, but I can go back to my model now. And this is going to be exported, can be exported as an STL or OBJ as needed.